He's pointing to you.
Hi, I'm Joe Calderoni. I'm the Senior VP for Communications here at Mount Sinai, South Nassau. I want to welcome our Facebook Live audience. Just for an update, today on Tuesday, March 31st, we have 282 COVID positive patients in the house. Of those, 61 adults are on ventilators. We have a request for 50 more ventilators with Nassau County OEM as we speak. We're here today with Lori Edelman. Lori is the Director of Nursing in our emergency department. She's been with Mount Sinai South Nassau for over 40 years.
Yes.
She started, like everybody else, as a line nurse and has worked her way up. She's one of the nursing leaders here at Mount Sinai South Nassau. We're very pleased that she's able to take a few moments and talk to us about what's been going on inside the hospital and inside our triage tent here during the COVID-19 crisis. As you can see, we are outside our triage tent. This opened up on Monday morning, and we are using this as a screening facility, not for COVID routine testing. Probably going to hear us say that about 5 times during this broadcast. So Lori, just tell us today, this tent did open relatively recently. Mm-hmm. What's going on behind us inside this triage tent?
So Joe, there's a lot of people that come to the emergency room, youngish, maybe have a couple of symptoms of fever, they're achy, they don't feel so well. And we don't want them to go into the main emergency room. That's for a higher acuity patient. So when they come in, they're screened by a nurse before they get here to ask them why they're here, what are their symptoms, and if appropriate, then they will direct them to the tent where they'll be seen by a healthcare provider and nurses and turned around and sent home. This is not a tent for people who are over 65, maybe have diabetes, high blood pressure, and a myriad of other illnesses. We're trying to take the people who have mild influenza-like symptoms or COVID-like symptoms and get them in and get them out quickly. This way they're not in the main ER, which is reserved for the very acutely ill.
So if I have shortness of breath, but
mm-hmm.
Maybe I had a fever,
mm-hmm.
I'm probably going right into the main emergency department?
It all depends on how short of breath you are. If you're 40 and you're a little short of breath when you walk a great distance, the nurse will decide who comes in here. And then if while you're in here they determine maybe he's a little too sick, then they'll flip you into the emergency room.
Okay, now you mentioned and pointed to another nurse. I don't know if James can show us a shot, but up Nassau Parkway, we have opened up a new entrance on Nassau Parkway. Of course, it was the original ambulance entrance. It's not
Correct.
new, but it has been widened and redone. Just explain to our viewers what is happening up there at the Nassau Parkway entrance, which was just reopened this week.
Right, and it closes. This is the greeter tent, which has an EDRN who asks a couple of questions to get a sense of if you're here for a twisted ankle but you don't have any other symptoms, and then she directs you. If you're here for a minor injury or maybe you have an emergency that's not COVID-like or an influenza-like, then you're going to go into the main emergency room. If you're here with the fever and mild symptoms, then we're going to put you in the tent to see where you need to go from there.
And again, just for our local audience, on Nassau Parkway, that entrance is open from 11 a.m. to 11 p.m.
Correct.
Explain to us what happens after 11 p.m.
So then that closes and everybody comes in the other entrance, which is on Oceanside Road. And that is where you'll come in and go into the emergency room where a greeter nurse is inside, and then they will determine where you go from in there.
So during the overnight period, between 11 p.m. on
Yes.
Oceanside Road, everybody's coming in
Correct.
Oceanside Road.
Correct.
And even 11 a.m. to 11 p.m., if you're an ambulance,
You're coming in Oceanside
Oceanside Road. Okay, so it's we got 2 entrances going at once during the day, but the whole idea is to screen people, to get them to this tent, those who
Correct.
need it, so that we can pre-screen you for any COVID-like symptoms.
And there are very clear signs on both entrances as to what time it is, where you're going in, and people directing people around.
What is the average wait time inside this tent? I don't want to put you on the spot, but is it moving through pretty well?
It is moving through very quickly.
All right,
Yes.
good. So you're being seen.
Right. Just sit in there, maybe, unless you're determined to be sicker than they originally thought. People are in and out maybe in 45 minutes.
Okay, and you're being seen by a
licensed provider. It is not a testing area.
Right, right.
It is a treatment. Most people are not even being tested, because if you have flu-like symptoms and they're mild, just go home and follow your regular, drink fluids, rest. That's what's coming in here.
Right, and so if you have just a cold, no fever, no shortness of breath, you probably should call your provider, your primary care,
or stay home
before you come here, or stay home.
Correct.
This is an emergency room, extension of the emergency room. Correct. And come here if you need emergency room care, like if you're short of breath, or
Correct.
You're dizzy, you're disoriented. That would be some of the examples to come here.
Correct.
Okay.
To the hospital. Yes.
All right, so the question I think really everybody wants to know, with this many COVID patients inside the hospital, how is the nursing staff holding up? We know that the nurses are really the front line of this crisis. We know that nurses are working extra shifts, extra long shifts. Right. There's many more patients in some units than there normally in terms of a nursing patient ratio. Please tell us how the nurses are doing.
So our nurses are like warriors, and they have been stretched. Yes, the volume is stretched. And we have a lot of additional nurses that we've pulled in from outside, nurses who normally work in off-sites, like in a family practice center or an office. They've come back to the main house because we need them. And so we've created teams of nurses to take care of the burgeoning admissions that we have. So far it's working very well. We have changed some of the unit makeups, and we've expanded some of those. It's so far it's working so good. We have PPE, though it's sparse, we're using it correctly, and we're using it as directed by the CDC and the World Health Organization. So we're taking care of our staff as well as the patients. We have a no visitor policy now, which puts a little bit more of a strain on the nurses, because they are not only taking care of the patients from a clinical perspective, but they are now the family, because the people are in the hospital, they don't have their families visiting, so they're providing a lot of the compassionate and care and company that might have happened normally with a family member. So they are really rising to the occasion. It's not a surprise, but it's not like Sandy either. Sandy was a lot of volume, but the patients were not quite as sick as this. These patients are very sick.
So I understood from our earlier discussions, the overall volume at the emergency department in terms of people coming in, if I got this correct, is down, but the percentage of people being admitted to the hospital is up.
Right.
Right? Just explain that.
The patients are much sicker that are coming in. So what's happening is that people are trying to not come to the emergency room, which they shouldn't. If they have a small injury, they're kind of just trying to see if they can manage it at home. But the people who are coming in are very sick. And those are the people that we're trying to put through the emergency room. So the tent is siphoning off the people who maybe you're not really sure, am I really sick, am I not really sick, and you're a little nervous about that. Okay, so we'll determine whether you need to go inside or not.
Okay, and of course, if you are on the edge and you're not sure, but maybe you're a little short of breath, you can always call 911.
You can always call your doctor and have them decide, talk to them on the phone, and they might be able to guide you. But if you feel acutely ill and really feeling like you're not going to be able to get out or get in, then you call 911, yes.
Okay. So just to get back to the nurses, you mentioned, because we have no visitors now because of the COVID crisis. So in addition to taking care of patients from a clinical standpoint, the nurses have to be a little bit extra for the emotional side of the patients as well. And at the same time, I'm sure nurses are worried about their own families and their own potential exposure. How are they handling that?
So nursing has always been an entire holistic approach. It's not just the clinical approach. We've always been the patient's partner. But now there's more of a need for us to spend more time with them, and it is an emotional situation for the nurses and the patients, but Everybody seems to, they're able to come in, do their job, provide the compassionate care they need to, and the company when necessary, and then they go home and do as best they can with their families. It is trying and taxing, but everybody's been coming to work and rising to the occasion.
So the morale is there.
Yes, the morale is there. People are frightened like everybody else, but we take the proper steps, and everybody makes sure that they put their PPE on, wash their hands, and administration has been very supportive. So we're just one step in front of the other, and we will get through this like we've gotten through other, emergencies. Nothing quite like this, but we will be able to get through.
So on the personal protective equipment, we are still soliciting donations. If anybody out there has personal protective equipment, particularly N95 masks, small size, I hear is what we use the most, because the nurses generally prefer the small size of the N95.
Well, they're measured. And the community has been, I cannot even begin to, I have never seen anything like this. They have been unbelievably supportive. Never mind the food, but the cards, and somebody left flowers on everybody's car. I can't tell you what that does to a nurse when you come out of work and you just feel like, oh, I just need a minute. And then there's this kindness that comes, that it is the most unbelievable, uplifting interaction between the community and the nurses. I've never seen, and I thank everybody. We're trying to send thank you cards, and so leave your name, because you have no idea the impact that you're making and on helping us keep going and keeping up and going forward.
So on that note, we did yesterday have a grocery delivery that Mark Barron of Parking Systems arranged, along with one of our board members, Joel Schneider. They delivered 300 bags of grocery to our staff. Also, David Liebertoff was involved. I believe it was his grocery chain that delivered the food to us from Brooklyn. Our staff lined up. They were delighted to get that little boost of support. And I think, as Lori really indicated, it's much more than just about the food. We really appreciate all the support that the community has shown, gotten behind this hospital during a very, very trying time.
Yes.
Today, by the way, Stop and Shop donated 2,500 meals, prepackaged meals for our staff. We're distributing those right now. They've pledged to come back every 2 or 3 days to make a similar donation of food. We're very, very grateful to Stop and Shop. Terrific for them to step up. They're also delivering another 2,500 meals to our sister hospital on the Upper East Side, the Mount Sinai Hospital. Right. So again, thank you very much, of course, to our nursing staff, our physicians, our support staff, and all of the community that has really stepped up and gotten behind us. Unfortunately, this crisis is not over.
No.
We are in as the governor likes to say, and I think he's absolutely correct, this is going to be a marathon and not a sprint.
Yes.
And we're preparing for that mentally and every other way.
We are. We pray every day that we're hitting the peak. We'll see when it comes.
All right, but we're ready. As ready as we can be.
We're ready as we can be, and we take it as it comes.
All right. Very good.
Okay.
Thank you very much, Lori.
Thank you.
And thank you to our Facebook audience.
Thank you.